The battlefield park was awash in red on this first day of December to mark World AIDS Day. 34 years after HIV was first discovered, it has killed as many as 35 million people worldwide and affected the quality of life of as many others, including family and friends. Because of drugs and improved lifestyles, people with the virus live longer lives. But are they healthier? That is the concern raised by this year's theme, as explained by the National AIDS Commission's Arthur Usher.
We're speaking to the access to medication, the access to health care, the access to all these things without discrimination and segregation and stigma. And so we're promoting that, as well as for everybody generally. You are entitled to health care.
The Ministry of Health's 2016 statistics show that there were 3,665 persons living with HIV, and in 2016, 104 persons died of HIV-related conditions. 11 fewer persons were diagnosed with the deadly virus in 2016 than 2015, but fewer men than women were tested. But no matter the circumstance, says Usher, the change must be manifest in one's personal behavior.
Belize has a bit of tapering off in terms of where we are with new infections, somewhere around 200, 225 for the past 2 or 3 years. And so while people might say, oh, that's an improvement, yes, it's an improvement, but we want to do better. And so what we try to focus in our awareness campaigns and in most of our engagements with the public is behavior change. How you live your life, how you maintain your health is very, very important and feeds into the HIV epidemic. And so while you have knowledge in terms of condom usage and all these other safety practices, knowledge has to translate to behavior. And if we don't do that, then we won't see the change that we need to see.
Along those lines, Chairperson of the AIDS Commission, Nurse Nora Longsworth, noted that there are concerns about those leaving medication early, resulting in spreading infections and deaths.
The government of Belize, through the Ministry of Health, continues to provide medication and other services to HIV/AIDS patients free of cost. Today, the national response includes attention not only to HIV/AIDS, but also an increased attention to TB, since data show that TB infections are high among HIV-infected persons. But worryingly, only 50% of those persons who should be on medication remain on medication, resulting in new infections of HIV and deaths from AIDS-related illnesses. Issues and adherence to treatment is being addressed, and renewed efforts are being made to sensitize the public on the importance of remaining on medication.
And with the age of first sexual encounters dipping ever lower, and the nature of those encounters spreading, Longsworth made the call for authority figures to start paying attention.
I am sending out a call to all parents, and I think we need to speak to our families, our communities, and our parents. Please pay attention to statistics, pay attention to the facts, which show that children are engaging in early sexual activity, beginning at as young as 15 years old or even earlier, which makes them vulnerable to sexually transmitted infections and pregnancy. The adult population, similarly, in Belize, also engaging in risky behavior, in ignoring the growing risk of HIV infections. So we are all called to action.
Aaron Humes reporting for News 5.